And then as you get older, like essentially what you're doing is like every time your muscle contracts, it creases your skin. And then you relax and it creases in the same spot. And then the collagen starts to break down. And that's what a wrinkle is. So a wrinkle is essentially a resting line. So that's what we can use. Things like microneedling that builds more collagen can kind of soften things. And neuromodulators like Botox or Dysport, there's actually 4 of them that are in Canada that we can use. And essentially what neuromodulators are like, people say Botox like they would say Kleenex. It's a brand. It's one of 4 that are approved in Canada. Yeah. So when I say Botox, I mean neuromodulators. But essentially what it does is it temporarily dampens the signal from a nerve to a muscle to contract.
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast. Hello, everyone, and welcome back to the Advanced Women's Health Podcast. I am so excited to have Dr. Nicola with us today from our Squamish clinic, and we are going to dive into all things what got her into naturopathic medicine, of course, but also aesthetics and naturopathic aesthetics, how we think through different types of formulations. It is honestly, you guys have heard me say this so many times, I am out of my comfort zone when it comes to aesthetics. So this is going to be you educating the audience.
Okay.
So before we dive in, I would love for you to intro yourself and just talk me through the journey into naturopathic medicine into where we are now.
Okay, definitely. So I essentially had always wanted to be a medical doctor. And then I think I kind of realized at some point along the way that I didn't want to just hand out prescriptions to people. I didn't want the short turnaround. And I have an uncle who's an MD, and just the lifestyle didn't seem like it fit. So I'd actually, when I did my undergrad, I was setting myself up to go to medical school. And then I got really into yoga, and I actually had an astrology reading with actually a really good friend of mine. And she told me that I should be a doctor. And I was like, well, I thought that's what I wanted to do. And then turns out I don't. And she was like, well, you should be a naturopathic doctor. And I was like, oh, like, what's that? And then I looked into the program, and there happened to be one of the only 2 schools in Canada very close to where I lived. And I was like, oh, I had a couple of other prerequisites that I had to do, but I was like, this is interesting. And so I did those other prerequisites and I applied and I got in, and it was the best decision I ever made.
I also just love that it's like, how did you become a naturopath? My astrologist told me to be a naturopath.
But I mean, I was always interested in medicine. I just the Western medical model didn't fit perfectly for me. So I was like, maybe that's not quite right. And then turns out it was really right. So.
Well, it's funny how many people on our team, especially but NTs in general, go through the world in that way, right? They're just like, medicine looks like this, right? Yeah. Medicine is this. This is what it has to be. And then when you kind of open your awareness, as I say, and get an understanding that there's a lot more that can go into it, you go in that direction. But that's full stop going to be my favorite introduction of all time. My astrologist was like, go for it. I love that. My astrologist has been right all of 2025, so I love an astrology. I'm about it.
Yeah. I mean, she's been right about a lot of things too. She's also a very good friend of mine, and so it's she's usually right. She's a witch.
I love that. So then what about when getting into naturopathic medicine, learning about it, what were you first called to? Because medicine is such a huge thing, right? Like, and then as an MD, quote unquote, you're like, okay, do I do family medicine? Do I go into pediatrics? So where did you see yourself landing when you first started thinking about naturopathic medicine?
So, I mean, I loved that it had all of the natural components to it, that you would actually talk about nutrition and about general health and herbal medicine, and acupuncture was part of I don't think it is at Boucher anymore, but was part of my training at Boucher. And I loved that we had all of these tools and that we still, Like I'm in BC, I can still prescribe a lot of medications, but I use that as a last resort. I mean, in some cases, it's the right thing to start with, but it's not the first thing on the list. Like I wouldn't want to prescribe someone a medication without asking them what they're eating and their stress levels and if they're exercising and taking care of themselves. So I was like, oh my goodness, there's this whole world of medicine that it just aligned with me. I was really into yoga at the time and it just really fit and it made a lot of sense. And I mean, I do quite a lot of aesthetics in my practice, which we're going to dive into, but that was never where I thought I was going.
Yeah.
I never imagined that.
And I think that's the thing, right? When I met you, you were like, what, 90% IVs and aesthetics. So what did that path look like from leaving school, getting into that world? Like, how did you get there?
I think when I graduated Boucher, I had like quite a lot of debt because the program is very expensive. And I think when you start out, it takes longer to build a naturopathic practice. I know you did it very quickly, but I think that's not how it goes for everyone. And so I was like, I want to do something else. And we have a huge scope of practice in BC. So I was like, I'm going to do some other certification so that I can do something else that's maybe going to build a practice a little bit quicker. And I was working with another naturopathic doctor at the time, and she had an aesthetics practice that was like overflowing. So I was like, okay, well, I'll do the Botox or the neuromodulator course and the filler course and just kind of see how that goes. And I will say also my astrologist did tell me that she's like something in my chart meant I would do well working in beauty industry. And so I brought that up to her and she was like, yeah, you should do it. Like that'll be really good for you.
Yeah.
And then I actually got very busy with aesthetics, right? I started in 2017. So I've been in practice for quite a while now, but I got really busy with aesthetics before I got busy with naturopathic. And I think part of that is, I mean, one, like it takes a while to get some experience in the naturopathic side of things. And there isn't a lot of mentorship besides when you really seek it out. Like starting your course, that's when my naturopathic practice really started to take off a few years ago. But basically my aesthetics practice got busy quickly because it's like you see someone, you give them a treatment, they love it. And then the next week, like 3 of their friends come in.
Yeah.
So that just built and like, honestly, up until I started working with you, like my naturopathic practice was like growing steadily, but it was a lot of patients that would come in to see me for an aesthetic treatment. And we'd have a little bit of time and they would tell me that like they're bloated all the time or that they're constipated. And I would be like, that's not normal. Like, do you have benefits? Like maybe you should use those. Like you can't obviously use the benefits for the aesthetic stuff. So come and see me for some naturopathic stuff and we can work on both aspects, which I think it's really important to work on both and not just the aesthetic side of things. So I have a lot of patients that see me for both.
Yeah. So then paint me that picture, because I know the question I get all the time, BC, NDs have a big scope, public service announcement, you now do not have to have specific education, credentials, etc., to do Botox or fillers. So make sure you see a doc who does have those certifications, everyone. Just putting it out there. But proof that they're not going to cause droopy eyelids. Anyways, but how do you meld those things together? Like how, because I get this question all the time, like people are doing Botox and fillers, but they're NDs. So what does it mean to have like a naturopathic aesthetic practice to you?
Yeah. So, I mean, I think a lot of it stems from like when we work on our health from the inside, we have more vitality. We start to feel better and we start to look better. And the same thing goes like when you start to look a little bit better, you feel more confident. And then maybe you're more likely to adopt some of those healthier habits to maybe like eat a little bit better, exercise, kind of take care of yourself. So I think it really works in both ways. Like you want to work on both pieces. And like, I mean, we're all aging. Like I just turned 40 and I used to have pretty deep lines in here. And like being in school for 9 years of post-secondary education.
Dealing
like
with all of you guys.
I was always concentrating and frowning. So it's like people would think I was mad just from looking at me. And I wasn't. I was happy. I just had like the 11 lines. And then when I started getting Botox, I was, well, one, Botox in the forehead helps with headaches if headaches are caused by tension in the muscles that we treat with Botox. But I started getting Botox and I was like, oh, like my face feels better. I feel more relaxed. I'm perceived in the world as being happier. I have less headaches.
You don't have an RBF.
This is a great thing. So I think that they really go hand in hand. And I think that people are seeking out these treatments anyway. And there are definitely some injectors that kind of go over the top. And part of my justification, which I think at the beginning, I really felt like I had to justify it because this wasn't what I thought I would get into. And I was worried about how I would be perceived from the naturopathic community. And I didn't really like share a lot or post a lot about what I was doing. But now, like, if people are seeking out these services, I'm offering them a subtle, more natural approach. Like, I often do quite a lot less units. Like, people will come in and they'll be like, oh, like, I'll give them the assessment and I'll tell them what I think we should do. And they'll be like, oh, that's like half the amount of what I usually get. And I'm like, okay, well, let's start here because you might love the result and that might be great. And if you need more, then you can come back, or if you think you need more. And like, that's another thing. People are always like, they come in and they're like, what do I need? And I'm like, you do not need any aesthetic treatment. This is not a need. Like, this is a want. And if this is going to make you feel more confident and feel better about yourself, and it's going to overall be good for your well-being, then it's a good treatment. And often, like I think like dermal fillers, for example, like has this rep for being really overdone, because you see people that are really overdone. And I see this in people is like they come in and like maybe they get a little bit of filler in their cheeks or their lips, and then they love the result and they get this dopamine hit from it. So then they come back in maybe 6 months and they're like, let's do it again. And I'm like, no, like, let's look at the picture before you had any treatment and now, and like, it still looks great. You still look really natural. If you want to keep working, there's other things that we can do, but like, let's not hyper focus on one area and continue to treat that area over and over again until you start to look strange. Like, I don't like that. And I always tell people, like, if you're considering cosmetic injections, look at the person that's doing the injections. And if they look overdone, then that's their standard of beauty. So you want to pick someone that looks like they maybe haven't had a lot of work done, or maybe look a little bit more natural.
Or in line with how you want to look, right? Like,
exactly.
I have some people and they want to look 10/10 over the top.
Yeah.
And I'm like, if that's what feels good to you, that's fine. But I think you're right. Like, find an aesthetic that aligns with how you would like to be portrayed too.
Totally. And like, I have clients that want to look like really big cheeks and really big lips. And like, I think earlier on in my practice, I would do that more. And the longer I've been in practice, the more I say no, because I'm like, you're a walking billboard for my services. And I'm only going to, like, if I think it's too much, like, I say no to people all the time. I'm like, if I think it's too much, I'm not going to do it for you, because I don't think it's in your best interest. Like, maybe you think you're going to get this dopamine hit and you're going to feel really good when you come in. But yeah, I turn people away often. And I think that's why I've gotten pretty busy with it and why I've been really successful with it, is because I'm always really honest with people. And I like a subtle, natural aesthetic. And if that's not what you're looking for, then I'm probably not the right person for you to see.
And there's lots. So like, take your pick, right?
Yeah.
So let's rewind a little bit. When we're talking about aesthetics and injections, what does that even mean? For someone who's sitting here being like, okay, I've heard the word filler, I've heard the word Botox, but what is the spectrum of treatments? What are people coming in wanting to treat? Like, give me a rundown. Because when you were like, oh, you just put a little filler in your cheek here, I'm like, excuse me? I thought you put filler in your lips. So like, again,
well, you can put filler anywhere.
I'm new to this, so Nicola's going to walk us through.
So there's lots of different things that you can do under the aesthetic umbrella. And so we'll just kind of start with aging. So the analogy I like to use is like, your face is a table. So the structure of the table is your bones, your muscles, your fat pads, and then your skin is like the tablecloth. And so you can think of like, when you're young, the tablecloth is like, fits right over the table. It's got like a good thickness to it. And then as you age, the table starts to shrink. So you lose mass in your bones and your muscles and your fat pads. And the tablecloth, like, it gets bigger, like the circumference gets bigger, but it gets thinner. So you can imagine how it starts to actually like kind of hang off of the table. So the telltale sign of aging is actually more sagging skin over having lines, because even when you see a teenager and like they raise their eyebrows, you can see lines, but they just relax them and the lines go away. And then as you get older, like, essentially what you're doing is like, every time your muscle contracts, it creases your skin. And then you relax and it creases in the same spot. And then the collagen starts to break down. And that's what a wrinkle is. So a wrinkle is essentially a resting line. So that's what we can use. Things like microneedling that builds more collagen can kind of soften things. And neuromodulators like Botox or Dysport, there's actually 4 of them that are in Canada that we can use. And essentially what neuromodulators are like, people say Botox like they would say Kleenex. It's a brand. It's one of 4 that are approved in Canada. So when I say Botox, I mean neuromodulators. But essentially what it does is it temporarily dampens the signal from a nerve to a muscle to contract. So it's like when I contract these 3 muscles in here, they create these lines, and then I relax them and they go away. When I get Botox in there, I can't frown as much. And I mean, I have Botox right now, but it's like, it's kind of at the end. I'm ready for another treatment. Yeah. But then essentially, like, your skin is turning over. Like, Botox doesn't do anything to a wrinkle that's already formed, but it stops you from creasing, and then your skin turns over. So if you start when you're maybe 45 and you already have some pretty established lines, like, they might go away completely, but it would take multiple treatments to get there. And you'd want to be consistent with it if you wanted the lines to truly go away. If you wanted to just soften things a little bit, you could do smaller amounts or come less frequently. But I find like a lot of women are starting younger, like in their 30s, and I call that baby Botox. And it's more of preventative from really preventing those lines from forming. So that's what a neuromodulator does. It's more often used like in the forehead and around the eyes. There's some things you can do like around the mouth. You mentioned resting bitch face. So another part of that is like when you see a teenager and their face is at rest, like the corner of their smile turns up a little bit. And then as we get older, it starts to go flat.
No.
And then it starts to go down. So there's a muscle.
I'm not old.
No, you're not. But when it starts to pull down, so essentially there's like a little muscle in there that is called the DAO muscle. It goes from the corner of the mouth down to the jaw. And when we relax that muscle that's pulling down, the relax is like a little bit of a lift. So there's other stuff that you can do in the lower face, but Botox is more commonly used in the upper part of the face. And then there's microneedling too, which is one of my favorites. And it's not injecting anything into you. It's essentially just creating little tiny traumas, little micro channels into your skin so that your body has a healing response and you build more collagen. So like when you cut yourself, your body heals. Like your body has this innate capacity to heal. Like you cut yourself open and it like kind of knits itself back together. But normally when you make a scar, the collagen is kind of all, it's not going in its perfect lattice formation, which it does in your skin normally. So with microneedling, they've done studies where they look at the skin under the microscope, and because it's essentially like perfect little puncture wounds, the skin heals with collagen in its natural formation. So you get an overall evening out of skin tone and complexion, and the skin gets thicker as you build more collagen, because as I mentioned, like the tablecloth gets thinner with age. So we want to thicken the skin, and so microneedling is essentially like skin tightening. And I usually recommend, like, a lot of people they just get Botox because it's quick and it's easy and it has a really nice result, but it's not doing anything to regenerate or to put anything back in. It's just really taking away. It's just like weakening the facial muscles over time. So I always recommend, like, especially girls that are younger and they're like, oh, I want to start Botox. I'm like, well, you should really start microneedling because that's going to be more like solve more of the root cause of building more collagen in your skin integrity and health. And then I find that any other treatments, they always look better when the skin quality is good. So if someone is considering doing dermal fillers, which there's all kinds of different dermal fillers, but the one that I do is hyaluronic acid, which is something that's already in your skin. It is a ground substance. So it's something that fills the space between the cells and the collagen and elastin fibers. And so essentially we're just putting back in a little bit of what time has taken out. That's how I like to do it. So like,
and it's just hyaluronic acid.
Yeah. Oh. I mean, there's like skin boosters that have vitamins and glutathione and other things added to them, but like a standard filler is a hyaluronic acid. And then there's different thicknesses in the fillers. So some of them have more crosslinks in the molecule, so it makes it like a thicker, denser. So like if you were putting filler in someone's chin or someone's jaw and it was like a deeper injection, you'd want to use something thicker that's going to be more mimicking of bone. Whereas like what you'd want to put in the lips, you want it to be really like soft and light and pliable so that your lips look natural and like they move when you speak and it doesn't look strange. And I think that like dermal fillers have gotten better and better over time.
Yeah.
And they can be done really subtly and really tastefully and not look ridiculous. And like we do, like our cheek starts to drop a little bit. We see more of, there's like a retaining ligament in here that we see more of with age. I mean, you.
I'm like, look at my ligament, everyone.
But like if you just put a little bit of filler right under that ligament, it can cause a little bit of a lift. So sometimes I ask patients to see a picture of them like 5 or 10 years ago. And I'm like, okay, this is the direction we want to go. We just want to make you look like a younger version of you. We don't want to make you look different. But yeah, I love microneedling. And then PRF is another one of my favorites.
Before we get to that, I have a couple questions. So when we talk about fillers, there's this huge conversation right now about like them being detrimental and people dissolving their fillers. What's going on there? So if it's mainly hyaluronic acid, like I'm confused.
What's happening?
Yeah.
Well, so I mean, it is hyaluronic acid, but it's hyaluronic acid that's made in a lab. It's a synthetic version of it.
Of course.
And some of it has more cross links in the molecule. So sometimes what happens is, this is dependent on patient factors and also how it's injected, but sometimes your body senses that there's something foreign in there and it kind of walls it off. And it makes the granuloma. So it essentially puts a bunch of cells around it. And then your body contains an enzyme called hyaluronidase, which naturally breaks down hyaluronic acid over time. So that's how we would dissolve something. So we would literally take like the same enzyme that your body makes and we would like inject it into the area that we want to dissolve. So if you have a granuloma and it's like the cells are walling off that area and you have like a lump or bump, that your natural hyaluronidase is not able to get to it and break it down.
I see.
Lumps and bumps can happen. And I mean, different people break things down at different rates. Like there's usually like the first time we put a filler in someone, it lasts for about 3 to 6 months, depending on like that would be more for lips, depending on the area. And then the more you do it, the longer it tends to last. So the way that I think about that is like your body sees it and your body's like, okay, so here's this thing, I'm going to break it down. But that takes work. And then it's like over time, your body's like, oh, here's this thing again. Like I'm not going to. And so there have been some studies where they've looked at people and they've still seen fillers like 8, 9 years after it's been injected, which isn't what it says on the monograph for the product. But sometimes it can stick around longer. And like, that's why I always give people informed consent. Like, there are risks associated with any procedure that you're going to do. So we make sure to talk about those things ahead of time. But again, like I think that more of those problems are happening when people are overdone and they just keep
what I was gonna say.
Going. Yeah.
Because most of what I've seen in when people are getting them dissolved is you're just like, like damn right. Because it's overdone. So I think to the original point you said, someone comes in, they get a little bit, they like how they look, they're excited. You say, okay, in 3 to 6 months, it's going to dissolve. They come back in 3 to 6 months and they're like, okay, let's do the same amount and or a little bit more. But all of that past stuff isn't gone. So it's like, if you do that over time, it's still going to be there for 9 years. Like that's just a reality of the human body.
Totally.
Yeah. Okay,
and which is why I always do, like people will come back and like, I'll tell them, I'll be like, no, it's still there. Like you don't need any more. And some people do break it down really quickly. Like some people, and like maybe they have a higher metabolism or for whatever reason, their body is breaking it down a lot faster. And then we maybe talk about other things because it's like this, there's a price to this stuff. And like, maybe we don't, if you have to do it more often, maybe it's not the right thing to do, but it's obviously everyone's choice. But yeah, it can stick around longer. I mean, I have dissolved some filler, like stuff does happen. Like lips, for example, like it's a more common area for migration of filler, which is when the filler kind of moves out from where it's been injected. And like the lips are a muscle. And so we're not trying to inject into the muscle. We're trying to inject above the muscle. But still, like every time you're talking and we talk and we use our mouths a lot, it can kind of push it out. So if someone has been doing their lips for 5 or 10 years, like at some point, they're just going to have to dissolve. And I feel like there's a big fear around dissolving, but often when we dissolve it, it looks really good. I've had filler in my lips. I haven't done them for a long time. Like I did them a number of times in a row. And the last treatment was maybe about 5 years ago. And then I did actually have a little dissolve and my lips looked better after the dissolve because it's like almost like the extra volume here is gone. And then it like flipped my lip out a little bit. And I was like, oh, I don't need any more. So I'd say don't be scared to dissolve if it looks stranger or like sometimes you just have to, and that's a risk of it. That's kind of the most common area. And like around the under eyes too, like the anatomy of that area as well is like there's not a lot of volume there, and there's like your orbicularis oculi muscle right there. So I don't often do a lot of filler in the under eyes anymore. I did it more in the beginning. Again, like over time you learn things. But now like I would almost always pick PRF in the under eye area over filler. So yeah.
So then where's the most common area people get filler? So lips, you said.
Like lips, cheek, temples. You can do jaw, chin. I mean, you can also like
Give her.
you can do filler with you can take a cannula, which I mean, you know this, Sarah, but it's a longer needle that's blunt on the end. And so you use like a little introducer, which is like a needle to make a little what's called a pilot hole. So it's like if I wanted, like, I'm going to lose volume around here. So if I wanted to like, I'd like get a little pilot hole right here. And then the cannula is long. And so we can like kind of like fan it in around and just lay like a really light layer of a thinner filler around that area. And another portion of that is that we start to get like when you see like the smoker's lines, there's like little adhesions between the skin and the muscle below. And then also we're losing that facial fat as we age in that area. And so you start to see those little adhesions. So I'm actually mechanically with the cannula. It's really satisfying because it's like I'm using an eraser and I'm like, just it's you feel these little like pops and snaps as we break up those adhesions. And then any little traumas to the area is going to stimulate your body to have a healing response and you build more collagen. So, I mean, really filler can be done anywhere in the face. There's areas that are more risky to do filler because there, as I mentioned, there are some risks to it. So like this area, like the glabella, which the Botox treats really well there. So I don't often I have before, but I don't do it very often because it's a riskier area. And like the nose, I have treated some noses, but I think the more experience I've gotten, I've realized like if you want nose filler, you should go to someone that does nose filler all day, every day.
Yeah.
Because it's a risky area. And
is that like the 5-minute nose job that everyone's talking about?
Like a liquid rhinoplasty. Yeah.
Okay. Yeah. Okay. We talked about this. Nicola doesn't have TikTok. Neither do I, but all of my friends send me stuff all the time. They're like, should I get this done? I'm like, I don't know what that is.
I know. And I think there's so many trendy things in aesthetics that like you see it around for like a couple years and then it's just nobody's doing it and nobody's talking about it anymore. So I definitely like to stick to the things that have been around for a long time. Like Botox has been approved in Canada since 2003. Like we know, I know what to expect
in the grand scheme of things. I thought it was a lot longer than that.
Well, that's in Canada.
Yeah.
I mean, it has been used longer than that, but it was approved for aesthetic use.
Yeah.
In 2003. Well, I mean, that's like more than 20 years.
Yeah. Well, just when you look at some medications that are like part of the cultural vernacular, you think Botox is one of them, right? And so you think you're like, okay, Health Canada is slow, which is a good thing. I'm not complaining. But at the same time, that's surprising. Yeah.
Yeah. And then, I mean, dermal fillers have been, I don't know exactly when, but there have been different dermal fillers that have been used and they've essentially just been like getting better and better. But yeah, well, like probably one of my favorite treatments is PRF or platelet-rich fibrins.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
I think the tablecloth analogy is really helpful. So when we're looking at PRF, where does that play into that? And then describe what PRF is, because many people have probably heard of PRP. So let's get into that.
So PRF is like the second generation. And when you look, it's actually more like the third or fourth generation because there's been some different iterations of it. But essentially, like there's two big differences. So PRP is platelet-rich plasma. And you make PRP by taking your blood and spinning it in a centrifuge at a high rate. So it's usually spun at 3,500 RPM for 15 to 20 minutes. So it's spun for a long time at a high rate. And then they've also added an anticoagulant to it or a blood thinner, which makes it easier to work with because it's not going to clot. Because as soon as you take blood out of the body, you have a limited time until that blood clots. So it's a little easier when you put the blood thinner in it. But also then you're injecting a blood thinner and the blood thinner is working on the platelets and it's a platelet therapy. So that has like, if you're doing like joint injections and you're going really deep into the body there, that's probably a little bit safer because there's a blood thinner. So you couldn't cause an occlusion with it. But when you're dealing with like aesthetics in the face, like we want the fibrin matrix, and we essentially want it to clot. Like we're injecting it under the skin like a filler, and we want it to clot. And then, so essentially when you make PRF, there's nothing added to it. It's just the blood. And then it's spun at either 700 or 1100 RPM, depending on what you're going for, anywhere from 5 to 12 minutes. So it's spun shorter and slower, and there's no blood thinner added to it. So what you get is you get essentially like a layer that has the plasma, the platelets, white blood cells, and the fibrin. So
and F stands for fibrin.
Fibrin. Yeah.
Yeah.
So essentially it's like the fibrin is kind of like a little scaffolding, and fibrin has lots of growth factors in it. And then the platelets have lots of growth factors. And then you have the white blood cells, which are essentially creating like a healing response. And you actually get a little bit of angiogenesis. So you get more blood vessels that are created to go to that area to bring more oxygen and nutrients so that you have healthier tissue.
And so when you're doing PRF, you're pulling up the platelets, the white blood cells, and the fibrin. Or are you just doing fibrin?
No, the whole thing. So when you make PRP, like you take it out of the centrifuge and 3 distinct layers. You see the bottom of the tube is red. That's like all the red blood cells, and the white blood cells, because it's been spun very quickly. So they're heavier. They're going to fall to the bottom. And then you get a really thin layer of the platelet-rich plasma. And then you get like a small layer of the PPP, which is the platelet pore plasma. So just because of the gravitational force on it, like the platelets kind of come into the middle, and then that's what you're using. And that's where a lot of the growth factors are. But when you make PRF, because of the slower, shorter spin, you almost just have like 2 layers. So you have the red at the bottom, and then you have like the liquid gold
the everything
at the
else.
top.
Yeah. Okay.
Yeah. And maintaining the white cells is really helpful. And depending on like, if you spin it, if you go more to like the 11 minutes and you go to the 1300 RPM, which we would use more like a filler, you're going to get like a thicker, denser substance. So it creates like more stability. But if you spin it at 700 RPM for 5 to 8 minutes, then you're like the product is not as dense. So that's more for like skin quality. We do like little tiny like micro injections, or we could microneedle that into the skin, versus if we're looking for more volume, which you can create. So I love this because when you're essentially like you're using your own blood, so you're not going to have any kind of immunological reaction to it.
Yeah.
You're also not going to create any like lumps or bumps that you can have with filler. And it's kind of a more like sustainable, subtler, long-lasting results. It doesn't give you the same dramatic result that you get after having a filler. But if you do a few treatments, like you can build up an area over time. And I find that I have patients that have been doing this treatment on for years, and like they maybe come in only every couple of years for a treatment, and they look great. And because we're like, so when I do this treatment, I take 4 13 ml tubes of blood. So I usually get like maybe between 6 and 10 mils of fluid to use. And so I can treat lots of areas. I like to do injections and then microneedling. So I might like inject some into the cheeks and some into the under eye. Like you can really put it anywhere that you would put a filler. And then sometimes I do like little tiny injections around like the crow's feet area to like build the collagen back up and soften the lines, and then microneedle plasma into the rest of the skin. And I guess I didn't really describe microneedling that well. So microneedling is a device, and there's lots of different devices on the market, but it has a number of little tiny needles on the end. They're small. They're like acupuncture needles, and they're going in and out of the skin. So they're creating those like perfect little it's like a whole bunch of them, creating these perfect little micro channels, which causes your body to have that healing response. You get really red because your body's going to bring more blood flow to the area. And then if you microneedle a substance into like your plasma into the skin, then you're just basically like getting all those growth factors and like pushing them deeper into the skin.
Right. And so this sounds painful.
Well, we put topical numbing on the face. So microneedling is actually like, it's quite comfortable. Like you might feel a little bit of a scratch, but it's not painful.
So
because
process is patient comes in, you spin their blood. Like if we're doing PRF and microneedling it, you take their blood, spin that down. You put on the numbing cream.
I would put the numbing on before I take the blood.
Okay. So numbing on, because these are the questions I get. God knows. So let's just do it. Let's do it once, and then I have it here forever. Then take the blood, spin that down. Then you take the numbing cream off. And the numbing cream, is it just lidocaine?
Yeah, there's different I have been using more lidocaine lately, which is what the Skin Pen is the device that I'm using, and they recommend a specific lidocaine. In the past, I've used other like benzocaine, tetracaine, lidocaine, other formulations, but it's some sort of topical numbing agent. And that just essentially gets like rubbed into the skin. And then in 20 to 30 minutes, your skin is quite numb. So in that time, I'm getting taking their blood, getting it all prepped. I like to give people a couple acupuncture needles at the same time while they're numbing and while their blood is being prepped. And it comes back to that sort of like whole person approach. So we're going to kind of calm the nervous system. We're going to do a couple of points specifically to their needs so that they get a double benefit while they're having the actual treatment. They can just kind of really rest and zone out. And
aging starts systemically, right? So it's just like, okay, we're working on hormones, we're working on inflammation. Like you can do all those things with acupuncture. So totally. Yeah.
Yeah. So I take it out and then I actually put it in this, it's like a test tube holder, but it's an ice pack. So I want to keep it cold because essentially like as soon as the blood is drawn, like it's starting that clotting cascade, and I want to slow down the clotting cascade so that I am able to use the plasma. So you have to be pretty experienced to do this because if we're doing PRF injections, like it happens pretty quickly because I have it all ready to go. And one thing to note too is I don't do topical numbing if we're just injecting the plasma, but if we're microneedling, then I do. Because if we're just injecting it, the topical numbing doesn't do a ton.
So you're going to inject here and here without any.
Well, if I'm doing it around the mouth, like it depends. It also depends on like patient. Like if people are nervous, like sure, we can put numbing on you, but the numbing is more for the microneedling. Like, so I draw it all up, get it ready to go. And then if I'm doing the combination treatment, I would start with the injections. So like we would talk about the patient's primary concerns, and I can usually have enough to do sort of 2 to 3 areas. And then I always like to save a couple mils of the PRF to microneedle into the skin. So you always want to use some sort of kind of like lubricant on the skin when you're microneedling. So we do that with the plasma. So I put some of the plasma on the skin and then I microneedle and then I put more plasma on. And then I'll leave the plasma. Like, so when you leave this treatment, like you look crazy. And like, because we've put a lot of like volume into you, like you look like you've had too much filler, but it's not going to stay there. Essentially, like the plasma is going to clot underneath the skin. So if we put it into your cheeks, will look quite big. The fibrin matrix is going to hold the platelets there and slowly release the growth factors over 7 to 10 days. Versus with PRP, you're only getting one shot because you don't get the fibrin matrix. And I've had PRP injected into my face, and like I have to say, like it burns a little bit because the anticoagulant is acidic. So it's almost, and then you're really bruised too because it's like almost you're injecting a blood thinner, which prevents you from clotting. So there's just more bruising, and it stings when it's being injected with the PRP versus the PRF. You're going to get a better longer term result, less bruising, but you look quite full after. And then of course from the microneedling, like your face is going to be quite red. You might have some little teeny tiny little like petechiae or little tiny bruises from the microneedling too. That's all fine. That will heal. If you do standard microneedling without your plasma, then you usually have a little bit of redness, maybe a little bit of swelling for kind of like 3 to 5 days. If you add the PRF, then it just speeds up the healing process. So it's usually more like 1 to 3 days of the redness and then a few days where you see more of the volume, but that it goes down quite quickly. So you usually want to do this when you have like maybe a day to recover after.
So you do it on a Friday. Thursday, Friday are hot for aesthetics clinics.
I mean, people do it every day. People have different schedules, but you just don't like, I always say too, like another really important thing with aesthetics is like, don't come and see me two weeks before your wedding and say, do a bunch of stuff. Like the general rule is that you don't want to do any treatments within 2 weeks of any like major events or public speaking, because that's always the time when you're going to bruise. Like I'm a very gentle injector. Like I don't see a lot of bruising, but it's the person that is like, and I wouldn't give someone a treatment 2 weeks before their wedding anyway, but it's like, those are the cases when someone ends up getting a bruise and like you're putting a needle into your face, like you could bruise. That's a risk. And we talk about that before so that they know, and it doesn't happen often, but like there's other factors that can increase bruising. Like iron deficiency is very common in women. And if you're iron deficient, then you're going to bruise easier. Like if you've had alcohol or ibuprofen or aspirin or any kind of blood thinner in the last sort of like 48 hours, that can increase your risk of bruising. So we go through all of that stuff before. So like if someone is brand new to the aesthetic world and they're not sure exactly like what they want to do and they just kind of want to know the options, then they're welcome to book in with me for a 15-minute complimentary assessment where I'll take a look at their skin. We'll talk about their goals. I always like to hear too if anybody's had any previous bad experience with aesthetics. Like I want to know what's gone wrong so we could make sure that, and like, I mean, like the eyebrows dropping you mentioned, like that's probably one of the most common adverse effects from a Botox treatment. And that's all about really like, it's all about the balance between the different facial muscles. Like this muscle up here lifts your eyebrows up. So if you just put Botox in here and you don't put anything in the muscles that pull your eyebrows down, then your eyebrows might drop a little bit. And that's like, it's not necessarily going to happen, but it could. So it's just like if someone's had that experience before, maybe they're a little bit more susceptible to it, or maybe it wasn't a very balanced treatment. So I would start lighter with that person and make sure that we like do a good treatment on the muscles that pull in. So the result of treating those muscles is a lift. But yeah, so I always want to do that. And then we can discuss the different options available because there's different things that you can do to address different concerns. And I like to think of more of a long-term approach versus like, I just want to do Botox today. I'm like, well, if you're going to do Botox and microneedling, you should do microneedling first because if you do microneedling and you've already had Botox, then your Botox might wear off a little bit quicker. Because essentially like Botox is doing a little bit of damage and microneedling is causing a healing response. So you want to have the healing response first and then you relax the muscles. So having I've worked with lots of people for a long time and like we have a schedule. We're like, okay, so once or twice a year, we're going to do microneedling. Yeah. We might do Botox a couple weeks after that. And then if you want to do a filler or you want to add PRF to one of the microneedling sessions, we plan it and schedule it accordingly. And then a lot of these people are coming to see me for their health too. So we're like, we're going to work on your health too so that you're not iron deficient and I don't bruise you when I give you the treatment.
Yeah. And so that, again, like you said, it does not matter if the tablecloth is old and weathered from the bottom, it doesn't matter. Yeah. And so that's the thing is we talk about aging and inflammation and oxidative stress and rusting, and that all shows up on the skin. So that's like, I have a bunch of people in my life who do aesthetics of sorts. And it's just like, I can't work miracles. Like, I'm not going to Kris Jenner your face with PRF. Like, you know what I mean? That woman had a very intensive surgery. Like, this is different. But I think sometimes we forget that, right? And I was actually listening to a podcast this morning on how we've lost frustration tolerance. And so if like when I was younger, when you were younger, if we wanted to watch a movie, you went to Blockbuster. They may or may not have your movie. You have to deal with that. But now, because none of that exists, you want a different show, you change it. You want a movie, you go to Netflix. Like we don't have to wait. And so our health is the one area you can't speed up. Yeah. But I think as we have more technology, as we have more of these quote unquote anti-aging things, people are like, oh, great, I'll get filler and microneedling and my face is going to go back to when I was 20. And it's like, that doesn't work. And then they end up frustrated, right? Yeah. So I think these conversations are really important because it's like, here's what it can do and here's what it absolutely cannot do. Yeah. And we need to be really realistic about those things when we start, how we start, etc. Because there's always going to be something trendy and like, that's okay. But that doesn't mean it works, that it's in your long-term best benefit, all of these types of things. And like you said, things come up, they're popular for 2 years and then they're gone. Why are they gone? Because they didn't provide any more benefit than what we have been doing forever. Yeah. And I think it's that's why the conversation about aesthetics in a naturopathic practice, I hear you, like I can get behind it because as someone who sees aging in my skin and who went through a very stressful period of time in 2025 and saw it in my skin, I'm like, oh shit, now I get it. You know what I mean? Now I get it. Like I get why there's this focus, because if I could get a treatment that would make that go away, I also forget the stress I went through because you don't look at it all the time. And I think that's the thing is when people are coming in and they're talking about their face, they may be talking about this line, but they are referring to their divorce. Yeah. And not that I got divorced once, still in the game. But it's like we don't understand that when like oftentimes you just want that line gone, but it's fundamentally what it represents. And so if you don't have a holistic perspective on that and you come back and you're like, well, no, I want more because I want this to go away. It's like, or do you want to talk about your divorce? You know what I mean? And the hormonal issues and the stress response that came out after that. But people don't think about that. And so I think it is the job of a responsible injector to understand what we're actually doing. And yes, like obviously you're incredibly skilled at the terminology, you know, all of the methodologies, you know, the muscles, like all these things that I could give, I do not know. But it's also, you're asking the questions when someone's there. You're saying no and then dealing with the emotions that come up and saying, okay, well, maybe we should take that over here.
Yeah.
Because those lips are not going to get that man to like you. And you probably don't want him if that's what he requires. Yeah. And like, I hate to be ruthless, but these are the conversations we have sometimes.
Yeah.
Right. And in an environment where people are just like, hey, like, boom, I don't want to talk about this. I'll give you whatever you want. It's not facilitating that whole person's health experience.
Yeah, absolutely. That's like so many people start to see me for aesthetics and I'm like, there's so much more I can help you with. Yeah. And then they come and we work on their health and then they're like, wow, I feel amazing. Like I feel confident. I look good. Okay. And it's those subtles. And like another piece of it is like people do hyper focus on one area of their face, like one line or that their nasolabial fold is it's like, if we just focus on that one thing, like you're going to get a better result if we focus. Like I like to do facial balancing with filler where it's like, I'm putting like a tiny little bit in their temple and a tiny little bit in their cheek and a tiny little bit in their jaw. And it's very subtle, but it makes them look way better. And this area looks better because there's a little bit more volume back here, like a little bit more structure in the table that's holding the tablecloth up. But yeah. So
then the last piece I'm going to ask, because I know we've talked about this and I was like, whole new world to me, exosomes. Okay. So after we chatted, I listened to a podcast. I can't remember her name, but the woman who like brought exosomes to North America, and was an orthopedic surgeon. And so she's like, oh yeah, we used exosomes forever in joints as part of like an anti-inflammatory healing process. And now, of course, like things go from ortho into aesthetics very commonly. So walk us through like, what are exosomes? How are they used? Why are they used? I thought it was like a term like Botox, right? And there was lots of categories underneath it, but I was wrong. So walk us through.
So you'll really understand this, Sarah. So an exosome
I like to think I'm smart sometimes.
Well, no, you will. It's like when you understand a little bit of cell biology, essentially it's a cell signaling molecule. So like in your tissue, you have cells and then you have the extracellular matrix, which is like the space in between the cells. And then there's collagen and elastin fibers. And cells are wrapped in a fatty acid membrane so that the cell can decide what comes in or what comes out. So essentially like an exosome has a little fatty acid membrane on it. And it's like the cell will package it with like, I think of it as like mail that it's sending to the other cells around it. It will package it with like growth factors and information. And then it's in that little fatty acid membrane and it can travel to the surrounding cells. So that is what an exosome is. And there's different sources of exosomes. So you can have like human exosomes, you can have plant exosomes, or you can have animal. So human exosomes, like there was a human exosome on the market that actually got pulled from the market. And yeah, I don't know exactly what happened there, but the ones that I prefer because I think that they have the most compatibility is bovine colostrum derived. Okay. So these exosomes come from an organic farm in Italy. They're really healthy cows. Essentially, the colostrum is the first milk that comes out after birth, but there's lots. So the baby cows get some too. But essentially, like the exosomes are like pulled and they have lots of growth factors that they're pulled from the colostrum. And then other things are typically added to them. If you're wanting more like brightening, they can put like a pomegranate extract in it. That's a really good antioxidant. That's more brightening, or more sort of like fine lines and wrinkles and aging. PDRN is sometimes added to them.
Salmon sperm.
Which is the salmon sperm, yeah. I mean, some people like that. They come and they're like, I want the salmon sperm. Or
put the salmon sperm all over my face.
Or you're just like, oh, okay, it's PDRN.
We're just gonna,
But essentially, like, there's no dairy in it. Even if you were allergic to dairy, like, you could still use the exosomes. There's no milk proteins in it, but they just get the actual exosomes and growth factors from the colostrum, and then they add other things to it. And so that can be
it's kind of like they're getting the envelopes from the cows, and then what we put in the envelopes in terms of the mail is whether that's the antioxidants from pomegranate or no.
Well, they come with some growth factors in them. So there's a lot, like, there's a lot of growth factors in milk, right? Because we're trying to like, milk is for a baby to
get
to
a
get
baby
them to
chubby
grow.
really quickly. Yep.
Get
Yep.
them to grow. So like, there is insulin like growth factor. There's other growth factors in there, but then other things are added as well. So the exosomes have the growth factors in them, and then we add other things on top of that to it. But yeah, so they'll have like, forget the number, I think it's like 20 billion exosomes per like 5 ml vial of the serum that you use to you use it to microneedle into the skin. You can't inject it. That's not approved in Canada. They're definitely doing that in other countries of the world. But right now in Canada, we can just microneedle it.
Okay. And so then when you're microneedling that in, why would you do exosomes versus PRF, like versus PRP type thing?
So, I mean, a benefit to the exosomes is that we know the amount of growth factors in the exosomes. So if like a patient is a little bit more mature, like the health of your PRF is dependent on your health.
Right.
So you're going to have more growth factors and more like mesenchymal stem cells in your plasma if you're exercising and you're stimulating those processes, and you're younger, you just have more of the good stuff. So as you get older, maybe we would choose exosomes, or if someone's nervous about having their blood drawn, maybe we would choose exosomes because we just skip that whole process, or someone's really iron deficient, or some reason that we don't want to use the PRF. What I call the Cadillac treatment is to do a combination of both of them. So we inject the PRF and then we microneedle the exosomes in. That one, I think then you're getting the benefits of both. And then we also have more PRF to work with because I don't have to save a couple mils of it for the microneedling procedure.
Gotcha.
And like, I mean, preference too, like you don't have salmon sperm in your PRF. So if you're like, I want the salmon sperm, then you would choose that. Or if you just don't want the blood draw.
I remember the first time I heard that, I was like, okay. So exosomes, like I've heard of people putting them in creams and stuff, but that doesn't sound like that makes a lot of sense. Like you would want them under the skin to a certain degree.
Yeah. Yeah, I would agree with that. Like I don't know how much penetration you're going to get of the exosomes if you just put it on topically, but I haven't seen, and there probably is studies on that. I haven't seen them, so I don't know the details. But from a educated understanding of it, I think microneedling would be a much better, because exosomes are pricey and you want to make sure it's working for you. You don't want to just throw your money away.
Exactly. Yeah, exactly. Because some of those exosome creams are like $200-$300 a bottle.
Yeah.
And it's just like, okay, like you want to ensure that works and that you're not just getting some kind of ceramide, right?
Yeah.
And so hydrated skin always looks better.
For sure. And then like that's another thing is like bringing up skincare. Thank you for bringing that up, because I think using good quality skincare is really important. If you're going to invest into these treatments, like a big portion of it is what you do at home and how you take care of like your nutrition and your sleep. And all of those things are going to be so important too. So it always comes back to treating the whole person. And even if you just come in because you want the aesthetic result, like if you start eating better and you start sleeping better, like you're going to look better. And then on top of that, we do some microneedling with your plasma or with some exosomes, and like you're going to look great. You're going to feel great. You're going to be more motivated. Like we get into those positive spirals where it's like a negative spiral, like you start feeling crappy, so you don't want to go to the gym, and then you eat poorly. It happens the other way too. Like you start to feel a little bit better. You're more confident. You're like, okay, yeah, I want to do this. I want to keep going down this path.
Well, it's funny. I call it high self-worth behaviors. So I will say to a patient, like, say you want to be the type of person who exercises, who eats well. Okay, that person has a sense of self-worth, right? They value themselves enough to eat in a certain way, move in a certain way, etc. So if you want to take on that identity, how can you take on a high self-worth behavior? Because when you start to behave in the way of the person you want to become, you will start to do more behaviors in alignment with that identity. It's all identity work at the end of the day. So this is why people can go shopping and get a new wardrobe and they hold themselves differently, because they identify as the type of person who does that, right? You get new makeup, you get new skincare, and you hold yourself differently. You hold yourself to a different standard. It's because your identity has shifted. And I think that's one of the pieces with aesthetics of why I think so many people are pulled to them, is because the frustration tolerance is small to a certain degree. You can put stuff in and see a change within a week, right? And then you're in this place that it shifts how you see yourself, which then shifts how you see yourself from an identity perspective. And I think that's, you're right. Like, to your original point, that's the power in it. Because if you have someone who looks at themselves in the mirror and is like, again, these things are just representations of the fact that I'm like not who I want to be, washed up, etc. These are terms I've heard. People have said to me, why bother? If that is part of your conversation, sure, you can go to as much therapy or EMDR as you want, but fundamentally, it also, if you can change one thing and change your behavior, I don't like, it's nothing but a positive thing. If you're in the hands of the right person and they don't abuse your like self-consciousness and all of these types of things, right? Which I think is where a lot of the fear is coming from. The reality is most of the people we grew up watching were filled with Botox and filler. It's just they did it in such a way that helped them build their confidence, that was subtle and natural, et cetera, et cetera. And it wasn't talked about back then. But anyone who was on a screen was doing some kind of procedure. It's just now we're in a world where we see the 3 times BBLs. We see people removing their ribs to have a smaller waist. We see people with lips that are so filled it's painful, and faces that have changed completely over a 3 to 5 year period of time. And I think fundamentally there's just this fear about what that means if you enter into that world, if that's where it's going to take you. And I always say, like, when you look at like the Catherine O'Hara's of the world, bless her soul, she's now passed, it's, the reality is most of them were doing something. And so we can't put everything into the same basket of the things that we see online, right?
Yeah.
Cool.
Definitely.
I feel like this was a masterclass. People are going to love this. I've learned a lot. Is there anything else that you really want people to take away in terms of knowing about naturopathic aesthetics?
I mean, I guess it's just like, it just comes back to like, none of this stuff is a need. Nobody needs these things. It's like, if something is really bugging you and like every day you look in the mirror and you're just like, all you see is this one line, then like there's something that you can do about it. And then maybe you don't have to focus so much on that, and you can focus more on just feeling better. And maybe you look in the mirror and you feel happier, and it can be done really subtly, really tastefully. Like, you don't have to look overdone. And yeah, we're all aging. And so
we're all in it together.
We're all in it together. Yeah. And like, the reality is like, still most people I know that are my age do at least like something from this category, if not multiple things. And not everybody talks about it.
Yeah.
So
totally.
Yeah, it's hard when you look around and you're comparing yourself to your peers, and your peers are all doing this stuff, which doesn't mean you have to do it, because it's a personal choice, and it's like, it's a want thing. It's not a need thing. But if you want to feel better about your appearance, there's things that can be done. Yeah.
Awesome. Well, thank you so much, Dr. Nicola. This was amazing. If you want to book in Squamish, we've got the links and everything below. And yeah, I'm sure there will be a part 2 because we'll have lots of questions.
Okay.
All right. Thank you so much.
Bye.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.